The surge in COVID-19 deaths has Gauteng's state mortuaries and private funeral parlours under immense pressure as they battle to process infected bodies. Dr. Lawrence Konyana, President of National Funeral Directors Association, joins us now. Dr. Konyana, thank you so much for your time this afternoon. Now, tell us about the current pressures that undertakers are facing with burials due to the COVID pandemic.
Good afternoon. Well, currently we're seeing a rise in numbers. I think that our biggest problem is the municipalities in terms of graves, the turnaround that we can have to bury. And that's really the bottleneck. But for us, most funeral directors, we are ready as we've been preparing since the first wave, and there are preparation in place so that we can cope with the numbers. Like I said, our biggest problem will come down to the authorities and the municipalities in terms of turnaround, in terms of the documentation that's required to bury, as well as the opening of graves for burials.
Now, your other biggest challenge that you had mentioned in the past couple of weeks was the lack of communication between yourselves and authorities regarding regulations around burials, etc. How's that been going at the moment?
Well, we've tried to engage with authorities as much as we can. Somewhere we do get along with them and we clarify certain aspects that we're worried about and certain things are clarified. But there are still a whole lot of issues that are still standing, not even just because of the COVID, but with previous other issues relating to the industry. But on day-to-day basis, we try to engage with them as much as we can. Unfortunately, with authorities, they tend to be more reactive than proactive. And some of these problems unfortunately catch us unaware.
Now, in that space where you are dealing with authorities that are very much reactive, as you say, and not proactive, as an association, you also have had many challenges, just in terms of how burials are conducted during this pandemic. What are some of the changes, did you have to make as an association in terms of how burials are handled during a pandemic?
Well, I think the most important thing is that we had to handle everybody as COVID infected or infected body so that we minimize risk to ourselves and to our clients as well as families. So we've had to change our operations to accommodate such. And also because different municipalities operate differently. So some of them impose certain regularities on top of what national has imposed. So that makes it sometimes difficult from one area to one area, especially if you are operating in many provinces or in many um, different regions of municipalities. It makes it challenging because then that means you've got to comply with those changes that certain municipalities impose.
I mean, we're in the second wave of COVID-19 now, which is pretty much similar, and we are told, to the first wave. But the fear is still there in terms of how you as funeral associations need to be handling, bodies and also that whole burial in terms of, once you have access to the body from the hospitals. What are some of the things that you will be introducing now, just to go in line with the second wave? I mean, what are some of the things that you are working with hospitals and authorities about? I mean, you mentioned that there's a lot of, lackluster attitude from authorities in terms of them being reactive. But what are some of the things that you have had to do as an association to be proactive and to make sure that your members are safe during the second wave?
I think one of the important things is that we communicate with authorities, especially at hospitals, so that we know if a body is infected, so we can inform the body of such and also inform them of the regulations, such as the body cannot go home the night before the funeral and the whole process where when the body must be in a number of body bags and how we handle it from there. Also from our point of view, from our staff as well, how our staff are protected using the correct PPE, making sure that they wear them at all times, and as well as protecting their family as well. And sometimes we even have to discourage them from washing the body as it's traditions and customs in some of our people.
And your relationship with families who've lost loved ones. I mean, we understand from the Disaster Management Act regulations is that an autopsy has to be conducted, and some of these backlogs happen there too. What's your relationship been like with families who've lost loved ones, and where you have to come in and make sure that you adhere to these regulations?
We try to help our families as much as we can to engage with families to facilitate those meetings where a postmortem is needed. Mostly a postmortem autopsy is needed if it's an unnatural death. And we, by all times, we try to engage with authorities to make sure that the families gets to pay on time to minimize the time where the family hasn't buried or the body is still with us. So it's mostly about communication and also families working with us and also communicating with us. As you are aware, one of the biggest problems is people who die at home because sometimes families refuse to disclose whether the person was COVID positive or if they came into contact with a COVID positive person. So those are some of the challenges. At least on the hospital side, the hospital will inform us. But for those who die at home, it becomes a problem. And sometimes the family doesn't really want to disclose. There's some kind of a taboo subject around in COVID with certain families, and it makes it difficult.
All right, Dr. Konyana, thank you so much for your time this afternoon. That was Dr. Lawrence Konyana, President of the National Funeral Directors Association.